has to work. And maybe the last thing is really in relation to the people themselves taking ownership of their own health. And this is really where the education and outreach to communities to understand, and particularly women, to understand if she's pregnant, what must she do? If she has a danger sign, where must she go? And so that's where our support is, at those sort of 3 levels. And we're doing it through what we call the UN Development Assistance Plan, which looks at a number of areas, not just health. It looks at economic growth, which is where one of the areas of OASIS. It looks at issues around education that we spoke to. It looks at social protection and safety nets for a number of people, vulnerable children, the elderly. It looks at issues of governance. It looks at how the movement is in terms of migration, urbanization. So there are a number of parameters, there are 10 actually, that we're supporting the government with.
As an economist who swears by the numbers, again here, if you look at the numbers, the maternity and infant deaths has reduced in Africa generally. But again, if you go to rural communities and you see what's happening on the ground, it's still unacceptably high in Tanzania. What do you think the problems are here? Why aren't we moving fast enough to get rid of this problem? Technology is there. You said there's political will. But then, things are not moving fast enough.
One of the things I think is, yes, Tanzania's maternal deaths have actually dropped very slightly. And again, it's an issue of data, how you play that data. But in real terms, it's actually, again, because of the population size, it actually has increased. So it's a difficult figure to put a hold on. And we actually think when we do the census next year, we'll actually be able to get much more tangible data. But I think, again, it's twofold. I think one of the issues is the fact that so quickly don't have access to family planning, and you mentioned it earlier, to be able to do that. So what they do is have children very close together, and that puts an impact on their health. So they're all issues related to, again, the community and the decisions that a woman takes. And again, I bring you back to the health system. Because, okay, when she decides, one, her ability to get to a facility on time depends on whether she has transport, depends on the road system that's there. And when she gets there, it depends on who she sees, because she might have a complication, and then in fact there's no doctor there, or even a nurse to manage her. So there are all sorts of delays in the system. I think fundamentally at a higher level, what we are also faced with is the ability to finance the health system. So it goes back again to, do we have the resources from a national budget to be able to put and invest it in the system? And sometimes the decisions we take, do we invest in a high-level hospital or sending patients abroad, or do we invest in prevention? If we had invested in $1 for family planning, which would have helped us face that child, the returns are almost $34 in terms of what it puts on the health system, for a health worker, what it puts on equipment. So I think sometimes we need to really think critically about where we invest resources and how we invest resources. And at the moment, when we look at the current investment in the health sector, internationally, the UN has said that countries should invest 15% or $40 per capita of their resources in the health sector. Tanzania is not near there yet. So there is progress, but we really still need to move ahead. So it's some of those challenges are really very real.
I want to talk about the fight against the spread of HIV and AIDS. Again, sub-Saharan Africa has the highest infection rates. Tanzania being one of the countries where generally, according to statistics, the rates have fallen, but not fast enough compared to the falling rates, or the world rates. Here, what kind of programs or initiatives do you have in the country in combating this epidemic?
Again, this is an area where the UN has come together really strong collectively to bring all our expertise and our skills into what we call a joint program for HIV/AIDS reduction. Tanzania has actually done very well. Tanzania's prevalence has dropped. It's about 5.5, especially on the mainland. Its incidence, how fast new infections occur, has also dropped in terms of a rate. But in terms of numbers, again, because of the population size, those numbers have increased. But generally, we're doing quite well. I think the most scary thing about the response in Tanzania, all the activities that are going on, whether it's voluntary counseling and testing, whether it's making sure young people have information to know that they need to have protected sex or they need to practice positive behaviors, whether it's access to antiretrovirals to treat children or adults. I think one thing that's really scary is that a lot of that work and that support is pivotal on external aid. So 90% of the funding for the HIV response in Tanzania is external. It comes from the Global Fund.
Are you saying that the country is not putting emphasis on
domestic resources? I think they are trying, but then again, we were lucky we had an audience with the parliamentary group in Tanzania. They now have a parliamentary standing committee on HIV/AIDS, and they had called the UN to come and talk to them about some of the issues, and particularly the issues of budgets. How can we deal with this? Because we have a number of priorities. You're asking us to, divide that pie, again, the budget, into many parts. How do we make those decisions? What can we do? And so that's one of the ways the UN is actually helping to look at, again, what other countries have looked at the private sector and a public-private partnership. Others, Tanzania particularly, is looking at an AIDS trust fund that begins to, again, accumulate some money to support the response. There are certain approaches that if we integrate better, we can actually reduce the cost. So you get more value for the money you put in. For example, integrating family planning services with HIV prevention. Instead of having one program that does HIV and one that does family planning, can you integrate them better? And that gives you a reduction in cost. So yes, I think Tanzania is not doing it's doing quite well. I mean, I think there's some sticky issues, but by and large, we're in the right direction. And so I think relative to some of the other countries, this is one of the areas that you see progress.
Okay. I think on the resource issue, Tanzania has made some progress. There has been a lot of reform has been going on in terms of the tax collection has improved, and you see over time the revenue that the government has or is able to generate has increased as well, and the government, with that in mind, has put together this National Development Plan, which looks at a growth plan which would help attract investments in areas which would benefit poor people more, and you will hopefully see greater reduction in poverty. It will also enable government to have access to more resources, as Julita mentioned, through public-private partnerships, and which have, in many countries, they have successfully been done, participation of the private sector in providing services as well, in building roads and then managing them and doing the maintenance. It's not always that the government has to do it. So government has put in place a public-private partnership policy, which will be hopefully implemented, and there are some other developments as well in terms of attracting private investment in the agriculture sector. Tanzania, as you know, has huge potential, a lot of arable land, good climate, and currently in the sort of the global world that we live in, we are now seeing that the food prices are going up, largely because of there are no doubt climatic changes also are playing a part, but also there's greater demand. China has grown, India has grown, there are some other economies which have grown very fast. So there is greater demand for food, which in a sense is good for countries like Tanzania, because Tanzania can now produce food and sell it, and farmers get a good income, which was not the case, I think, 10, 15 years ago when people were looking at agriculture. We were seeing a trend of falling food prices. So, but of course it affects the poor as well, because if we are net consumers of food, so it affects us. But countries like Tanzania potentially can benefit from that. So government is looking into those areas, and UN is trying to help bring in its global expertise, how countries which went through the same phase, what kind of policies they put in place in order to increase the revenue, so that that can be then invested into in human development, such as health, education. And so those are areas where the government is looking into, and some policies have already been put in place.
You talk about policies, but I mean, for instance, there's the government initiative of agriculture first to empower farmers and reduce poverty through agriculture. But again, when you look on the ground, most Tanzanians are involved in agriculture, and most farmers are poor. So something is not right somewhere. This poverty alleviation initiative seems not to be working perhaps as planned, really. Do you think maybe a different way should be taken apart from agriculture?
Of course, I mean, you cannot simply rely on one sector. It's always good, I think we do it at the household level also, in order to minimize risk. You diversify your sources of income or anything. But again, it's about the potential. We are living in a world where food prices are likely to continue rising, and Tanzania clearly has a comparative advantage. And on top of that, if you look at countries that have grown in the 70s, 80s, they did it, yes, they industrialized, but in most of the cases, agriculture played a very important role. If you look at countries like Indonesia or Malaysia or even Korea or Japan for that matter, they industrialized, but there was growth in the agriculture sector as well. There was productivity which fueled, in fact, growth in other sectors. What often happens is that if there is growth in agriculture sector, which means lesser people will be involved. But that doesn't mean then you have more people unemployed. What agriculture can do, it has these backward and forward linkages. It fuels other sectors, like certainly you would need agro-processing industries or equipment and so forth. So it helps to feed other industries where people can find work. So I think the government is doing the right things, particularly looking at what's happening at the global level, and clearly Tanzania has an advantage as far as agriculture is concerned. Unfortunately, if you look back in Africa in general, there has been very little investment in the agriculture sector, but that's changing now. There are commitments at the regional level. If you look at the recent budget, the percentage investment in agriculture sector has increased. But with the resource content, I think it's always going to be a challenge. So that's why it's important you bring the private sector in, they can make investments, because it's a profitable sector after all, they can benefit from it.
It is a profitable sector, but there's been so much contention about private investors, especially in rural communities, in the mining sector, for instance, and even in your agriculture sector that you mentioned. They're coming in, they're investing, but the benefits of that investment is not seen in the local communities where they operate. What seems to be the problem here? It seems that companies are coming in, making a buck, and then going away with that buck. What about the environment where they operate? The government may be making more money through taxes, but then it's not the extra income is not being translated to the poor.
I think generally if you look back, countries had relied mostly on growth. It was assumed that high growth rates would automatically lead to poverty reduction, because there will be more resources available, it will lead to job creation. But in reality, it hasn't happened, because investments that you make, you have to be very careful where these investments are going. As I said, clearly in Tanzania, the growth has been there, but it hasn't translated to adequate poverty reduction. Maybe what we need to do is look at the investments, where the investments have gone. For example, in the mining sector, of course, it generates more revenue for the government, which is good, and that can be invested in human development. But in terms of the mining sector, its ability to absorb or create jobs is far more limited compared to manufacturing. So you have to be, I think you need to do a proper analysis when you're attracting investments, whether it's domestic investment